Welcome to Plus Talk on Plus Life. A few weeks ago, we took Plus Life global, landing in Bangkok, Thailand, for a special visit to the Tangerine Clinic, the first sexual health and wellness clinic in Asia run by and for trans people. Take a look. Thank you, Rena. It's nice to be at Tangerine Clinic.
Welcome and thank you for visiting.
Sawadika.
Sawadika. Wow.
Is that okay?
That's a good job.
So I know this is a very, very special place, the Tangerine Clinic. For someone when they walk in off the street for the very, very first time, what's the first thing that surprises them about this place?
Yes, I think many people, they always think that this is the clinic providing cosmetic services or aesthetics clinics, but in reality it's actually sexual health and mental health clinic that we are providing for trans and gender diverse populations.
Yeah, and it is more than just a clinic though. Why
Yes.
is it such a special place for the community?
Yes, we are not only the clinic, actually we provide safe space for our clients to come and then they can drop by anytime. If they are thinking of us, they can come and talk to our counselors, they can come and talk with our staff because most of the staff here, we are, the clinic is actually led by the trained transgender people. So trans always providing the services to the transgender communities.
For somebody who has never heard of a clinic specifically designed and programmed for trans people, what do you want them to understand?
Yes, first of all, I would say that because of stigma and discrimination, especially in healthcare settings, remains one of the barriers to healthcare service access among the transgender population. And the reason why we established the first transgender-led clinic in Thailand, because we want to promote access among the trans and gender diverse population. And this clinic was actually led by the transgender community for the transgender community. Even the names of the clinic was also named and selected by the transgender communities themselves as well.
Why Tangerine?
Yes, before we selected this clinic, we actually organized the transgender community consultation back in 2015. And at that consultation, the transgender communities agreed that we should have a transgender dedicated clinic in Thailand. And lots of trans community representatives, they came up with different names of the clinic, but finally we wanted to go for this name because it's not too feminine, not too masculine, and it's kind of gender neutral, so that everyone can come to visit us and use the services here.
I love that. What has been sort of maybe the most unexpected or unusual thing someone has asked you when they've come into the clinic?
Because of the name, right? It's not like the name that we normally use for the clinic, but when we got a call or with someone drop by, they said like, oh, they asked like, do you sell drinks or food? But yeah, unfortunately we're not. We're trying to do that a small cafe corner, but because of the building, didn't allow us to do so. So yeah, it's just a clinic and safe space for our communities.
You mean no tangerine juice?
No, we were thinking of having a tangerine ice cream before, but it was not possible.
Or maybe a tangerine lollipop if I've been good when you do the blood draw.
Yeah,
you know,
that's a good idea.
You were a good, brave, strong person.
Wow.
How does this clinic flip the script, I guess, on traditional healthcare?
Yes, before I would say that there's not many transgender people coming for HIV and sexual health services. As I told you, because of stigma and discrimination or judgmental attitude from healthcare providers in Thailand. But after having opened this clinic for 10 years, we have seen around 7,000 of the transgender people. They are all my clients and they are not coming from Thailand, but they're coming from other countries, especially from Southeast Asia as well. So we have seen trans people coming to use the services. They're having HIV testing. Many of them, they are on PrEP, and those who diagnosed with HIV, they successfully initiated ART on the same day of the diagnosis. It's kind of, we facilitate them to access to healthcare services.
And then they can become undetectable and untransmittable.
That's the most important part as well.
So there have been a lot of cuts coming from America, USAID and PEPFAR. Have any of the funding cuts that we have initiated through the current administration directly affected this clinic? And if so, how? Can you tell me more?
Yes, I think I would say that the clinic, the Tangerine Clinic, is really got a large effect from the US funding cuts in the past few months. For example, the program that used to be supported under the USAID has been terminated a few months ago. In addition to that, we also used to get the support from the NIH, US NIH, to do research related to trans people. And all of that were also terminated in the past few weeks as well. So right now, all of the transgender clients have to pay for the service fees from their own pocket. So we're using kind of co-payment scheme for them to access to the services right now.
So right now people can still get their services, but they have to put their hand in their pocket a little bit.
Yes.
That must affect
Of
your
course.
clients
Yes.
significantly.
Yes, I think we have seen like decreasing number of clients in the past month because many transgender clients, when they knew about the co-payment scheme, many of them, they were reluctant or they were not ready to pay for the services. So that's why we have to think about how are we going to help them to promote or to seek other additional fundings from other sources. But right now it's really difficult because every country, every community, they are in the same problem.
So how does that directly affect a trans patient who has been coming here for a long time, is on successful treatment, and now they can't? What does that mean for them and their health?
First of all, gender affirming care, the support to gender affirming care, for example, counseling, mental health, were terminated, were withdrawn. So that transgender people normally can access to mental health services, can access to gender affirming care. They're no longer available here. And as you know, that a wrap-around services, not only for HIV and sexual health, is actually facilitate access to the transgender clients to access to HIV. But now there's no longer gender affirming hormone treatment and mental health. And if they want to get these kind of services, they have to pay, which is not possible at the moment.
And for you, what do you worry that that does for HIV, not just in Thailand, but in Southeast Asia and obviously then around the world?
Yes, of course. I think it will affect the HIV epidemic among the transgender populations and other key populations as well, especially for youth of other key population. I think we're trying to promote like educational activities, trying to reach them online, but all of these activities were also terminated as well. So we are likely to see like new HIV infections among young key populations in the near future.
New infections that did not need to happen. That's heartbreaking.
Yes, I know. Because the US government used to do some good stuff in terms of HIV response, especially for the community leadership, but right now the landscape has been changed.
So politics and all of that aside, what would you say to somebody who might be scared to come through the clinic doors for the first time if they're a transgender person?
Yes, I think first of all, I would say that don't be scared because you are coming here, it sounds like you are coming to see a new friend. You know, you don't need to have anything, you don't need to have illnesses. You just come and talk to us. And then after talking with us, it's your decision whether or not you would like to get the services. It's okay if you don't want to have HIV testing. You just come to talk to us, and when you're ready, you can come back anytime. Yes.
If you could describe what the Tangerine Clinic means to you in 3 words, what would those 3 words be?
Oh, that's very difficult. I would think about the first word is about empowerment, because this is the place that we empower the community. The second, I would say that is belonging. If you're trans and gender diverse population of people, you come here, you will have sense of belonging because this is your safe space, provided the services in a stigma-free environment. And the last thing is, I would say thank you. It's like ขอบคุณค่ะ in Thai. It's like we really appreciate when you are coming to use our service here. Yes.
I love that. Thank you. So let's get real for a second. What do you hope that the rest of the world, places like America and other countries, what can they learn from what you have built here at Tangerine Clinic?
Yes, I would say that in the past 10 years that we have operated the Tangerine Clinic, I really believe in the power of the community. So in other health response, including HIV, we should let the community lead, and the community should have the informed decision around their own health. And that will be leading to the sustainable way of, like, you know, driving the solution for their own community. Yeah.
And lastly, what do you want to say to people in America who think, oh, all of this USAID, it doesn't affect us, or it doesn't matter, you know? What do you want people to understand about what you have built here and why it's so important?
I think the evidence-based data already inform the positive impact of what we have been doing around the world, including HIV response. And if you are like the defunding situation from the US, I think is really killing the people around the world. And it's not only around the world, it's also in the US. So I think please reconsider the policy and make it more accessible and enabling to other key population that has been affected by this policy. Yes.
Rena, I'm so excited to be here. Thank you for inviting Plus Life to come and have a look at the clinic. This is such a beautiful place, full of very nice, happy people. As you said, I don't feel like I'm walking into a medical clinic.
I know.
It feels like, you know, I'm here and seeing friends.
Yes.
Congratulations.
Thank you so much.
Thank
Thank
Rena.
you for stopping by.
Of course. That's going to do it for this special edition of Plus Talk in Thailand. Hey, thanks for watching. What did you think? Leave a comment below. And remember, you can always like, follow and share. We're across all your favorite social platforms at Plus Life Media. Till next time, be nice to one another. We'll see you soon. Bye-bye.